Welcome back, guys, to another episode of Hormones Happen. I'm your host, Jeremiah, also known as the Optimized NP on TikTok, and I've got a really special treat for you guys today. I have Temberly, who owns her own direct primary care practice. And I know we've talked about it before, but we're going to kind of flesh out what is a DPC practice and why is it so integral to healthcare in general. Temberly, thanks for being with us.
Hi, thank you for having me. I appreciate it.
Yeah, of course. So, what got you started as a nurse practitioner? What has your nurse practitioner journey looked like up till now?
So, I graduated with my Doctor of Nursing practice in 2015, so almost 11 years ago. And when I was in school and going through all of that, what I knew is that I didn't want to do family practice, oddly enough. I didn't know where I wanted to focus, but I didn't think I wanted general care. And my last clinical rotation was in an incredible hospital model with a great provider that was, precepting me, and I fell in love with family practice. And so I've been doing that since I graduated over 10 years ago.
And so, what led you to saying, hey, you know what? I'm done with insurance. It's time to actually explore cash based direct primary care services?
So, like so many other clinicians, I think I was just enamored with the entire process. And so everything I was given, I believed wholeheartedly. It's all factual, the studies were done, and I kind of follow those. When all the COVID stuff came, things just weren't really adding up. And then that started this little journey into the rabbit hole. And that's when I really discovered that medical industrial complex. And I was disgusted with the fact that all this information that we were being provided, that we were then turning around and trying to educate our patients. And so many of those things were wrong, frankly. A lot of it was unethical or just not in their best interest. And then when we're doing that, plus having to jump through these impossible hoops of trying to appease insurance and seeing how our outcomes were worsening because of the all of those regulations that insurance was
Mhm.
putting in place. Care was by far worse. You're cramming in more patients and they're not getting what they need. We were spending more time on paperwork. And all of these things just started to accumulate. And it got to the point that I started to realize what I was doing, what we were doing just wasn't the right thing. And I think most of us go into medicine truly wanting the best for the patients. But when we're all burnt out and we're unhappy, and then that's also coming across to our patients and our communities too, I realized that we were in need of a radical change. And I didn't know what that would look like exactly. I just knew that there had to be something else, a better option. And I discovered people like Dr. Keith Smith and these providers that were doing these more of a cash base and completely just circumventing the insurance, and how care was better, outcomes were far better. Everybody's experience was improved. And so then I started to kind of put those pieces together and see how I could bring that to Wyoming. We have some direct primary care clinics here, a couple that are full. I mean, they're doing great. But again, it's still an unfamiliar concept. And I really want to get that word out to everybody.
We need to. We need to. As practitioners, as people that want to help other people, it's paramount that we let people know, guess what? You have choices, you have options. Now, before we get too far into it, why don't we backtrack and you tell us a little bit about your clinic specifically, where you're located, what you do, and how people can get a hold of you?
Sure. So I'm in Casper, Wyoming, which is pretty central Wyoming. And my husband and I both are from a really, really small town. And so I really love the idea of taking care of, ranters and these guys that don't have time to sit in a waiting room for hours. They can't make appointments weeks in advance. They need taken care of now when they need it. And so being in central Wyoming allows me to be able to service a lot of the counties around here. And then also because we're not doing that traditional medical model anymore, I can do a lot more in regards to telehealth or texting, email, that direct access and communication, which can help considerably.
It's a concierge type
Mhm.
setup. And what people don't understand is people think like, oh man, you have to be rich to get that kind of care. But the reality is you couldn't be further from the truth. This is more, in my opinion, from looking at numbers and data, more affordable than using your insurance when you actually look at coverage versus what you get. Because let me ask you this, Timberly, how long is your average appointment with your patient?
And right now, it's about an hour, 45 minutes
Insane.
to an hour.
Where else are you gonna find that? Where else are you gonna find an hour appointment? I mean, you're lucky to get 10, 15, maybe 15 if you're lucky, minutes with your general practitioner in an insurance-based clinic. It's a hamster wheel. And so with this DPC model, what are some of the benefits that people can expect that may only know insurance?
So my membership is a monthly membership fee. It's $125. Within that membership, you have unlimited office visits. And so if you need to be seen multiple times over the course of the month, there aren't any additional copays with that. I have point of care testing, strep tests, UAs, all of those types of things that are included with your membership. For doing skin biopsies, something like that, the pathology will cost you extra. If it's advantageous to use your insurance, you can. But in regards to the procedure itself in house, I'm not charging anything for that. DOT exams, I don't charge anything extra. And I also draw labs, which are steeply discounted, about 90% discount from what you can get anywhere else.
Huge.
And I'm contracted through Quest, which is a national lab. And so we know that the results are coming back accurate. We're not cutting corners by any means, but by getting rid of that middleman, we can get rid of all of that massive administrative waste that costs so much money for people.
Absolutely. One of the things that really bugged me the most when I was in primary care, I did primary care in a prison actually. So very, very regulated. Okay. And so the thing that really bothered me is everything was based off protocols, right? It was based off decision making trees. It was based off just algorithms. And the reality is, how many people actually fit in these little diagrams? No one, because we're people, right? We're not study populations, right? We're people. And so it was so frustrating to know, hey, I really know that this is going to be a great treatment for you, but unfortunately, it's not even possible for you. We've got to try A, B, and C before we even consider it. And then we still might not get it. And that was one of the most frustrating things for me is why did I do all this work to make these, what people would say high level decisions and not be able to actually implement them? But with DPC, that's very different, right?
Exactly. Yeah. So we find what does work, and then we can go with that. So we don't have to follow, again, all of those little steps. I don't know how often in practice would you tell people, you know, the studies say we're supposed to do this. But what we found in real life, in practice, is that that doesn't work. And it's a huge waste of time and it's a massive expense. So being able to practice medicine to our scope, the way that we were trained as clinicians in school, whether you're PA or an NP or an MD, we were trained so far above being just a referral center, basically.
Mhm.
You come in and we weren't doing anything special. Like you're saying, you were just kind of following that algorithm and we need to break away from that and actually start providing good care to people and affordably.
Absolutely. Now, when you first started your practice in Casper, Wyoming, correct? What was the general consensus? What were the thoughts? What were people saying? Were people a little skeptical?
Yeah, and they still are. So a lot of my peers, especially, just keep saying it doesn't work. It doesn't work. It's not going to work, and it
I hate
does.
that.
It's proven to work in other places. It's worked for decades. It's just unfamiliar around here. I just completed my first quarter, and it was really, really successful already. So it does work. In regards to patients that once they start in that DPC route, I don't know if they ever go back to a traditional hospital system again because it is truly that great. But it is just trying to educate and get that word out there and get people to truly understand what it is. This isn't something that you can advertise easily because it really is about more relationship. And so it's just trying to get in contact with people so that they can ask questions and you can really try to prove this model.
Right. And one thing that I hate is I hear people say all the time when someone's starting a new DPC, it's just not going to work. Sorry, the population's too heavily Medicaid or Medicare. It's like, get out of here. It is so applicable to every population. And guess what? The people that just don't listen and just continue moving forward, they thrive. I've talked to a lot of practitioners. I've talked to over 50 practitioners, half of them insurance, half of them DPC. I will tell you that the DPC are always happier, right? The DPC are like, oh yeah, I have plenty of time to do a podcast and we can schedule this stuff. Like I make my schedule. It's beautiful. Insurance are like, oh my God, this is such a freaking nightmare. Can I go DPC at this point? And the thing is, I do think there are some use cases for insurance. I'm not saying no one should ever have insurance for whatever, catastrophic things happen. But when we're talking about preventative medicine, I really think that we need to be in control of our health. As people, we deserve to have say in what we do. And we may say, you know what? I know that according to these algorithms, I need to do step A, B, C. I don't really want to. I really just want to do step D. No, that's what I feel comfortable with. That's what I want to do. And I think that that's our right to be able to choose what we do for our health as long as we're making informed decisions.
Exactly, exactly. And I know you do a lot of peptides. I'm not functional medicine by any means, but I love things like peptides. And I do work
Mhm.
with some compounding pharmacies so that I can provide that as an option for people. A lot of people take me up on it. A lot of people love it.
Yes.
But it should be an option where it's not, in any other model. Things like hormones, which again, you're really familiar with in primary care. It is almost
Yeah.
impossible to get anybody on like a testosterone replacement. It is so difficult. And that's what they need. That's what they're going to benefit from. And you're just kind of falling into that same trap. And that's been difficult as well because I've always been a little bit of a contrarian. So when I was in
Mhm.
practice, I like to kind of push that envelope where I can. But the difficult thing now is realizing that I don't have to kind of do it under my breath or
Right.
anything like that. So now I can openly just sort of practice the way that I need to and that I should be and I'm trained to do. And so that's been a little bit tricky is kind of learning still that I don't have to fall within those tiny little parameters, but that is getting better now that I've been in it for a few months.
Yeah, you build your confidence up, right? When you're first starting, it's kinda like starting over. Like, if you remember back when you first graduated, it's like you're hesitant to even prescribe a Tylenol, right? You don't wanna
Right.
cause liver failure. Now you transition to this DPC where it's like, "Wow, I can do what I want." And it's kinda like that hesitation again, like, "Okay, am I doing the right thing?" And then you see the patients just thrive, and you see just how thankful they are, the amount of relief that they have when someone can validate their concerns and say, look, I'm on your team here. We're going to work together. I can't get you to that end goal. You can't get yourself to the end goal, but together we can. We work together as a team and just that's all the validation you need. And of course, you're going to get flack from peers. A lot of peers are like, "Oh my god, you're just going rogue. You're going, you're in gray zone." And for a lot of what I do, very gray zone. But
It-
the reality is I am very comfortable in helping people. And when you build that relationship with a person, then it's worth it. It's absolutely 100% worth it. I'll be in the gray zone forever. I do not
yes,
care.
exactly. And you do when you have that relationship. And your patients have the confidence in knowing that they can text or call or email or get in if there's something that they're not sure about or if they're feeling anything. Having that confidence and being able to contact you as the clinician is tremendous. And so that also gives you a lot of room to practice a little bit differently to where it isn't just, take this medication and leave. They know that you can kind of give them more instruction and guidance on lifestyle changes or day-to-day changes that can make a huge impact on their health, but they feel okay with that because they know that they can just text you if something's not working or not quite right. And come to find out, a lot of the times that is what they needed. They didn't need another prescription. They just needed that confidence and feeling more empowered with their own health, to be able to actually get where they needed to be. I feel like we don't need to intervene nearly as much as our traditional system says we do. We
Mhm.
really just be there to support and guide our patients. And if you're seeing 4 or 5 patients an hour, you can't support them. I mean, you just can't. And if they can't get a hold of you for days or even weeks at a time, then they don't have the confidence in that either.
No way. How could they? That's one of the reasons why I think a lot of people lose faith in healthcare in general because I've got this problem, but I can't communicate it to anyone. I can get scheduled in 3 months. By then, depending on the problem, it's either horrible or it's gone. But still, that trust in healthcare is just absolutely gone. When the reality is, like you said, oftentimes they just need support. In traditional insurance based care, we get stuck into this wheel of like, okay, someone comes in with a complaint, they leave with something, a prescription, something. They gotta leave with something, right? They came all the way in, they're
Yep,
gonna leave with something. The reality is, if we could just spend 30 minutes, 45 minutes, an hour just talking to them, people are going to actually listen, right? Because people don't really care what you know until they know you care. And how can you tell someone that you care in 10, 15 minutes?
exactly. Yeah, 10 or 15 minutes that you're behind the computer clicking the boxes. who knows if how much of that is
Yes,
even spent really engaging
exactly.
with them.
It's horrible. I don't, like I said, I still have like trauma from just primary care days. And so, I also don't do primary care. So I'm really thankful that people like you do because it's so huge. Prevention is key. Prevention, and I think people are really getting privy to this. Prevention is the future because we don't want to go to hospitals. We don't want hospitalizations. We don't want those hefty padded bills. If we can prevent these negative outcomes, which we totally can, why not? What's stopping us, right?
Exactly. Yep. Yeah. I mean, that's exactly right. And I think our so much of where we are is more of that sick model. It really is focused more on keeping people ill and going back in and back in over and over and over. But through this model, we can address all of their needs in one appointment a lot of the times. We can take care of everything that they need when they need it and when it works for them. If we're working around calving season or if we're working around
Mhm.
closed roads and things like that, we can get them taken care of entirely and hopefully de-prescribe and get them off of some of those medications that are probably contributing to why they feel so terrible now and kind of moving around all of that and getting them healthier than they've ever been and then keeping them healthy.
Huge, huge. The maintenance, keeping, getting healthy and then staying healthy. Very important. Now, tell us some of the services that you offer specifically at your practice.
So I'm full scope family practice. The only thing that I don't do is OB. So some of my members are pregnant. I'll take care of their medical conditions during that time, but I don't do OB. So really everything from babies up, a lot of chronic care. So hypertension, diabetes, all of
Mhm.
those things. And then that health optimization aspect as well. Skin procedures, acute care. So if kids are sick, if people need something like that. Women's health, all the GYN type stuff too. Yeah, so really it is true family practice, true primary care where I can take care of all of your needs. I am the only one in the office, so I draw the labs that I send out to. I'm the one
Wow.
answering the phone for right now. Hopefully that changes soon, but
Okay.
I do all of that. So I don't have, a specific niche. They always say, the riches are in the niches, but
Mhm.
I feel so passionate about getting it back to true, just primary care and that general practice. And so I can take care of all of that and all of those conditions, mental health and those sorts of things. I do work with some alone, single standing radiology groups here so
Mhm.
that I can get patients discounted rates on radiology studies too if we need that. And hopefully, the idea is to prevent having to refer them out to as many specialists. Joint injections, things like that, those are all included with the membership. Occasionally, it's necessary, but not as often as I think the system was getting us towards.
Mhm. Wow, that's a fantastic deal. You do a lot of things that you do a lot of small procedures and stuff, and it's just you. You're a one-woman show, huh?
Yeah, yeah, for now.
Okay, cool. Are you planning on shortly getting, maybe an admin or at least someone to answer the phones and whatnot?
Yeah, so I'm considering maybe a virtual MA
Mhm.
to help with phones, prior authorizations, that sort of thing. Potentially bringing somebody in office. And then as all of this grows down the road, getting another provider in here too would be ideal just so that we can continue to offer great care that's more accessible with better outcomes, more affordable to everybody. But yeah, I'm trying to I think part of the charm with direct primary care is that we keep
Yeah,
the overhead so low. And so I
very.
really want to avoid getting a big old team because that's when all the prices go up and usually our systems start to fail on us too.
Yes, low overhead is key. It's absolutely key. And the thing too, when you're building your team is you have a culture, right? And you're in the process of developing that culture. So the people that you put in, the people that you introduce right away, this is going to be huge because now we're adding ingredients to this pot of culture, right? And what are we really making, right? And what are the views and the opinions of the people that you talk to, right? Like for me specifically, it's very, it's somewhat niche. And so for me, it's really important that the people that I bring in are on board with it, right? Could you imagine me bringing someone in that was anti-hormone, anti-peptide? It would be a nightmare. It wouldn't work.
Right.
So I've got to almost find people as radical as me, which can be hard to do. And then we we kind of go radical together. And so building a team is huge. But once you find the right team, it's just so much synergy and it
Yeah.
just makes life easier.
Yep, absolutely. Absolutely. But yeah, finding the right people can be hugely difficult because you need to find somebody that their values and their ideas align with yours. But at the same time, you don't want to hire somebody that's just like you, or else you're never going to grow. You'll stagnate if everybody's too similar. So I
Yeah,
think trying to find the right team is imperative to long-term success. So it isn't something you want to just jump into by any means, but it's hard too because as you're getting busier, it's harder to spend the time to find the right person.
it is.
And so that
It
balance is
is.
tricky.
And some people don't like change, right? When I first got my admin to answer phones and triage calls, there were some people that were a little upset. They're like, "Well, why aren't you answering these questions right away now?" And the reality is I still answer the clinical questions, but there's a triage process now. And so, of course some people had left because of this, and that's reasonable. It will happen. But these changes need to happen for sustainability, right? In order for us to be able to grow this practice, any practice, to help more people, we have to have systems in place. And you can only be a one man show for so long before you realize I'm the bottleneck here. I can only help X amount of people because I'm one person. But the reality is, the amount of care that you give and the amount that you're able to help these individuals, you kind of build a special relationship with them. It's more than just patient A, patient B. These are people, right? And you talk to them like people and you kind of get feedback from them. And what I like to tell a lot of people when we're discussing hormones, because, hormones are so individualized, is that you're in the driver's seat. I'm in the passenger seat. If I say, hey, you know what? I think the best option is to go right. But you say, you know what, Jeremiah, I want to go left. And you tell me why. And it's safe. Guess what? We're going left because you're in control. I'm here to make sure that what we're doing is safe. But no one knows you better than you.
Yep, exactly. Exactly. Yeah. So we're here to guide and, kind of help facilitate all of these things. But by no means should we be in here just dictating their care, which
Mhm.
I mean, it's just not the right thing to do.
Yeah, do you remember in nursing school, NP school, joint decision-making process? Yeah,
Yes,
everyone I talk to, they laugh about it because we all have some degree of trauma tied to it, but how often is joint decision-making process ever implemented in traditional insurance-based primary? It's not. It never is. There's never a joint decision-making process. It's like, "Okay, this is what the guidelines say. This is what we need to do." I don't know. How do you feel about that? That's kind of what we have to do. But the reality is like when you give people choices and you just let them make an informed decision, it's incredible how actually reasonable people are when they have the facts. That's all they need is the facts,
exactly.
And so unfortunately, in insurance, we just assume people are unreasonable and we have to tell them, spoon feed them what the next steps are. When the reality is like, guys, these are adults. Let them make some decisions. Now, kind of speaking back to that, you also treat children as well?
I do. Yes.
Okay.
Yeah.
Wow.
So babies all the way up through the lifespan.
Okay. So do you see a lot of people come in and they're like, hey, I want to get my whole family on this plan? Do you see that quite a bit?
Yes. So, and like I said, it's 125 an individual, but I do have it capped at $300 a month for families with dependents. And so I've got several families that have, three or more little kids. It's only $300 for the entire family. And
Mhm.
it's great because there are a lot of times where I can get them all in. I might be seeing a kid for an illness, but mom needs a refill on her medications and dad's got a question about his lab work or whatever it may be. So it's really great because it kind of meets the families where they need to be, or where they are in that moment. So yes, I have a lot of families. I even have some, three generations: his grandpa,
Oh,
his son, and then their kid too. And that's a lot of fun getting to know everybody. And that's where that, country doc feel comes from. I'm from a really tiny ranching community. And I love the idea of you really actually knowing that family and being able to take care of them the way that they need and the way that they want and expect, but everybody all at once. And it's a lot of fun doing that.
yeah, and it's a different world. Those small little country towns are so different. I did one of my clinical rotations in a small little town called Eads, Colorado. Super small farming community, also trucking because they had a gas stop. Like the Love's gas station was like the supermarket. And I was out there for months at a time, and it is a different world. And unless you're immersed in that, like what's going on, like you're going to be an outsider, right? You have to be
Yes.
engaged in some of the specific occupational hazards you might face, some of the cultural issues, social economic issues you face. And so you're filling a really specific niche for people that probably, from my understanding from working with some of these people, would opt to just say, you know what, I'm just not going to even attempt it. They don't get this stuff checked out because it's such a pain in the ass. But now
Exactly.
it's like, let's do it. Let's get my health taken care of. Why not? It's easy now.
Yeah. Yeah. And I love that. And it's very, I mean, the culture is so different and we don't take to outsiders very well.
Sure.
So
Yeah.
it makes a big difference kind of understanding that and understanding their mindset and their challenges, just like you said. It really is a tremendous opportunity both for me, but for this community and for those, those people in general. There's a lot that we can do.
Now, do you do any kind of like weight loss hormones? I know you said a little bit of peptides.
So same thing, it's not something that I advertise or throw out there, but I do have, quite a few people that are doing some different weight loss programs. I love to talk about food and nutrition, so you get that whether you want it or
Yeah.
not. But I do have
Cool.
quite a few people that are on, the GLP-1s and a sloop combo, things like that.
Mhm.
I have quite a few, especially men, but quite a few people that are on some hormone replacement. But again, being in that traditional model with family practice, it's not something that we got to do very much of. And so I love it. And I understand a lot of it just off of my own personal research that I've always kind of been drawn towards. But it really is more just health optimization and then that primary care aspect.
That's huge. That's huge. And right now, are you licensed in any other states or is it strictly Wyoming?
Just Wyoming, and I've contemplated if I should get more of a compact license and then maybe offer some more telehealth type services.
Yeah.
I don't know how saturated that is or how difficult it can be to advertise and really kind of get that outreach. So if it'd be worthwhile. Right now, my primary focus is actually looking more at employers and offering those employer sponsored health benefits. And so there are a few companies around here that I'm going to sign up with. And then just moving forward, I was going to market more towards that direction first. But I'm always considering, it's always in my mind if I should get a compact license and kind of spread out that way too.
That's smart. I know a lot of DPCs that do exactly what you're talking about, where they actually work with a corporation to be their essentially their healthcare, right? That's their health insurance in a way. And they do amazing because that's all you need. If you get one large contract, that's it. That's all you need. But I would always, and I always tell everyone, hey, we're nurse practitioners. We can, there's independent practice states. Get get at least one or two telehealths out there. Just you never know. You never know. Telehealth's taking off. It's not going anywhere.
It is. So how do you market for that? Because marketing can
Mhm.
be tricky with telehealth. Well, with all of it, but especially with
Sure.
telehealth.
Specifically Google Ads. Google Ads is the best way to market any telehealth services. Sure, you could do, Facebook, TikTok, Instagram, and it's, I'm not going to say they're useless, but it's more of a flash in the pan. It's really hard to say what you're going to get. Google Ads, you specifically target a state that you want, specific city within a state, and a population even, right? You can be very specific and you just market your services. You may feel that it's saturated, but it's not. There's so many people out there that are getting privy to this. This isn't something that's going to go away anytime soon. It's only going to gain popularity. And there are more than enough patients for every clinic. So I wouldn't worry about it at all. I mean, of course, there's competition out there, but I wouldn't worry about it. People need you, Timberly, specifically, not, Joe Schmo down the street, right?
Right. Yeah. No, I think that that's a great advice, and I will definitely look into it a little bit more.
Yeah,
For
absolutely. So, kind of wrapping this up here, let's say we have someone that's kind of on the fence, like, hey, I've done insurance based primary care my whole life. I just don't feel like I'm getting heard. I don't feel like people are listening to me. What do you want that person to know as far as what they can do, as far as actionable steps to take control of their health?
I think it's so important to seek out places like direct primary care clinics where the providers have kind of taken that turn to focus and put priority back on you as the patient. So you need to find somebody that works for you, not your insurance company, not big pharma or whatever it may be, but somebody that works for you specifically. And you're going to find that almost always in a direct primary care clinic, whether you have insurance or your self pay, and you're still going to benefit from this. And so looking in that route under that free market type medical model, I think is important. I've got a website, I have Facebook. so people can find me there. And then they can always call, and I'm happy to visit with them on the telephone and answer any questions they have. And if it's something that they want to sign up with me, that's wonderful. If maybe they're in a state I'm not licensed in yet, something like that, then I'm happy to try and help guide them on how they can find a similar model because it really is where medicine needs to turn. We cannot keep functioning the way that it's been so far. And we need to focus more on this direct primary model so that we have the patient's interest at best heart.
I could not agree more. Timberly, thank you so much for being with us today.
Yeah. Thank you so much. I appreciate it.